Good afternoon, and welcome to this webinar of the Geographical Sciences Committee of the United States National Academies of Sciences, Engineering, and Medicine. Our speakers today are Mary Price, who will discuss the ethical dimensions of using geospatial tools to address societal challenges, and Elisabeth Root, who will examine geospatial considerations for community-based contract tracing. This is the fourth and final webinar in a series organized by the GSC on ethics and biases in the geographical sciences. My name is Budu Bhaduri, and I'm a member of the Geographical Sciences Committee, and I will be moderating this webinar. Just a quick few details before we get started. Mary and Elisabeth will each speak for about 20 minutes, and then we will hold a question and answer session for the remainder of the time. We will be taking questions through the Q&A box located at the bottom of your screen. Please type your question in the box at any time and click send, and I will be picking those questions from there at the end. The webinar is being recorded. Please understand that any questions you submit may be read aloud and included in our recording. A link to the recording as well as a copy of the slides will be posted on our website within the week. If you have any technical issues during this event, please contact Zoom support at 1-888-799-9666 extension 2. Before I turn it over to today's speakers, I just want to say a few words about the Geographical Sciences Committee. Next slide, please. We are a standing committee of the National Academies of Sciences, Engineering, and Medicine. The National Academies are not-for-profit organizations with a dual mission: to honor the nation's top scientists and to provide objective, independent advice on science, technology, engineering, and medicine. Established at the direction of President Lincoln, the National Academies have been providing these services to the country for over 150 years. Next slide, please. The Geographical Sciences Committee provides at all levels using the methods of spatial analysis and representation. We address the geographic dimensions of human-environment interactions, spatial location and concentration, and place-based research and policy at all spatial scales. The committee also fosters international cooperation by serving as a liaison to the international geographical organizations, including the official US liaison to the International Geographical Union. The committee is supported by funding from the National Science Foundation. Next slide, please. Here is the current membership of the Geographical Sciences Committee, and I am one of the members on this committee right now. Next slide, please. Here are some of the geographical issues the committee has tackled in the last 3 years, and you can come to our website to find more details about our meetings and open discussions. Next slide, please. Now I would like to introduce today's speakers. Mary Price is a professor of geography and international affairs at George Washington University, where she has taught since 1990. A Latin American and migration specialist, her studies have explored human migration's impact on development and social change. She has been president of the American Geographical Society since 2016. Her current research is on the spatial dynamics of immigrant inclusion and exclusion in cities. She is also interested in participatory mapping and open source platforms as a way to engage students in research, service, and analysis. In 2017, Mary participated in an UN expert group on sustainable cities, human mobility, and international migration. And in 2018, she gave the keynote at the UN Commission on Population and Development. She is co-authored to 2 leading textbooks in world geography, Diversity Amid Globalization, World Regions, Environment and Development, which is in its 7th edition, and Globalization and Diversity, Geography of a Changing World, which is in its 6th edition. Her publications also include a co-authored report, Migrants, Inclusion in Cities, Innovative Urban Policies and Practices, co-edited book, Migrants to the Metropolis, The Rise of Immigrant Gateway Cities, and over 60 refereed articles and book chapters. Mary earned her graduate degrees in geography at Syracuse University and her undergraduate degree from the University of California at Berkeley. Elisabeth Root is a professor in the Geography Department and the Division of Epidemiology at the OHIO State University. Dr. Root also has affiliations with the Translational Data Analytics Program and the Institute for Population Research. Her research and teaching focus on the intersection between geography and public health, where she explores geographic patterns of health and disease using quantitative spatial methodologies. Her current research focuses on 3 broad topics. 1, social dimensions of health and the ways in which population and environment factors jointly impact human health and well-being. 2, community level factors which impact maternal and child health with a focus on maternal opioid misuse. And 3, the evaluation of place-based health interventions using geospatial analysis, geographical information systems, and large administrative data sources. Dr. Root actively engages with local and state government to explore ways in which state data resources can most effectively be used to inform policy and target health programs. Most recently, she began working with Innovate Ohio to utilize a multi-agency platform which integrates administrative data sources from health, welfare, public safety, and the judicial systems to help the state develop data-driven responses to the opioid epidemic. Elisabeth has several major international health projects in Bangladesh, Honduras, Philippines, and Indonesia, as well as 2 research initiatives in the United States. She received her BA in Anthropology and Public Policy Analysis from Pomona College, and her MA and PhD in Geography from the University of Maryland and the University of North Carolina, Chapel Hill, respectively. With that, I'm going to turn it over. But before that, a last reminder that if you have any difficulty in technical issues, contact Zoom support at 1-888-799-9666 extension 2. And you can subscribe to the future GSC events at the website that you can find on the slide. I would like to turn it over to Mary for her presentation now. Mary, it's over to you.
Thank you, Budu, and welcome everyone who's listening. I am Marie Price, the president of the American Geographical Society, and today I want to talk about a program we began a year and a half ago called EthicalGEO, and particularly an initiative that began this spring, our Location Tech Task Force. So let's begin. First of all, those of you who are not familiar with the American Geographical Society, we're actually the oldest geographical society in the United States. We were established in 1851 in New York City. We have always tried to occupy an intersection between government, business, academia, and education. And as a result, our membership is often from these diverse sectors. It's not strictly an academic organization. But we believe by bringing people together in the same way that the National Academy does from these different sectors, there's a chance to have deep conversations and also affect policy and make sure that geographical research and sciences can be used to improve people's lives. Next slide. So our research team, the leadership at the AGS, some familiar faces. Senior Vice President is Alec Murphy, who's been on the GSC. John Konarski, a PhD from Syracuse, although not in geography, is a long career in business. He's our executive director. And Chris Tucker, a PhD from Columbia, who has worked in government and the private sector. And so in this leadership team, in addition, we have a robust council from government, academia, and business who help advise us. Next slide. I put this up because we are an organization that's been around for a long time. In the early 20th century, our director was a man named Isaiah Bowman. And Bowman had an influential career. He was tapped by Woodrow Wilson to lead the Inquiry, which was a massive American initiative in remapping and reimagining Europe after World War I. And then he was later Roosevelt's geographer, and then it later became president of Johns Hopkins University. And this quote, while it's not exactly gender neutral, I think the point is, to a revolutionary degree, man changes geography as he goes along. All geography is always new. And that is so important because there is this pervasive vision that geography is something you learn in 6th grade and that you're done. And one of the things that I encourage my students to do is to think in maps, to think about how the map is always changing, how there are alternative maps, asking questions about who's creating these maps, what are the data are out there. And certainly the geospatial revolution has made geography available to everyone in their pocket when they have a cell phone and they use location tracking and mapping devices. So I think it's an easy case to make, but I don't know if we make it as well as we should. And certainly being engaged in this discussion of ethics is a way of bringing the relevance of geographic change to a broader public. Next slide. So just as a quick reminder, some of the ways that we reach out to the public in the AGS is we have the Geographical Review. It was preceded by the Geographical Bulletin. So the Society has been publishing this journal for 130 years. But we also have some interesting online sources. Focus on Geography is a digital magazine that has been available open source, and I invite you to look it over. And then to educators and our members, especially AP Human Geography teachers, we send out a daily geo, which is a Monday through Friday kind of geography in the news, a way to start class and connect what you're learning in your books to what's happening in the world. And then, of course, the usual social media presence of Facebook, Twitter, and Instagram. Next slide. So the EthicalGEO project began about 1.5 years ago. We received funds from the Omidyar network. And our idea was to activate people with interest in geography, whether they're computer scientists, entrepreneurs, policymakers, practitioners, students, to submit their ideas about what would be examples of ethical projects in geography, geography for good as a shorthand, and also concerns they have about how geospatial information and big data could be blended in ways that could be quite concerning. And one of the interesting things when we launched this campaign is that we decided, rather than use a more conventional written proposal, people submitted a 3-minute video of what their project was, an idea. We had over 200 submissions, and it was a really creative and kind of liberating way to read about and learn about what people's ideas and concerns were. Next slide. So when we began EthicalGEO, again, this was in early 2019, these were some of our primary concerns. Obviously, privacy is a huge concern for everybody, and especially with real-time location tracking, this was certainly a concern. In terms of politics, we were very interested in how governments use data, especially in mapping, but informing policy, but also how governments could regulate the private sector and its use of data. And these discussions obviously go well beyond geography, but that was some of our concerns. We also believe that there was enormous potential with open source platforms for empowering communities that seek social change, seek justice, to create alternative maps. And we wanted to make sure that these voices and these tools would be widely available. So we've partnered closely with Youth Mappers, which is an organization funded by USAID, and my university, George Washington, was also one of the founding members. We also see this geospatial tools are critical for encouraging a more sustainable planet, monitoring climate change. And so this geographic inquiry, these new geographies that we're creating are certainly one of our interests. And lastly, and this is a concern, especially in the Omidyar family, about property rights and how geospatial tools could be used for people to be able to, especially in informal settings, in informal neighborhoods, to stake claim to their territories and use that to formalize informal ownership. Next slide, please. So after we received all these videos, we selected 7 EthicalGEO Fellows who have been working with us for the last year. In fact, a couple of the EthicalGEO Fellows have even spoken to this committee, and I'll show you their images in just a minute. But again, with the dual concerns of how geographical tools can be used for good, social justice, greater equity, but also what are the ethical concerns and who controls the data. And we began this before COVID, and our EthicalGEO Fellows joined us. We have an annual meeting at Columbia University called Geography 2050. We did a pre-workshop where all the fellows presented their work, initial ideas, and we've been following up with them, but unfortunately in a more of a virtual setting as COVID has changed everybody. You can go to the EthicalGEO website. If you just Google one word EthicalGEO, it'll come up. There are blogs, there's information on the fellows process, and then also the location tech work, which I'll talk about in a minute. Next slide. So here are some of our EthicalGEO Fellows, the work they're doing. It's a range of people. You already met David. He spoke last session, I believe. He does a lot of work on open mapping in Tennessee. Dr. Alfredo Hironava is very interested in coastal fishing communities and reducing poverty. William Evans has work in Tanzania on property rights, and Greg Babinski's project is looking at GIS and technology in the city of Seattle. Next slide. And 3 other EthicalGEO Fellows. Again, we had 7. Erica Hagan was one of the leaders in Map Kibera, so she's very interested in community mapping and open source platforms. Dara Seidel, who's worked, spoke to this committee as well, is interested in masking location and in training young people of how to not necessarily have all your movements tracked. And Father Michael Frazier, who's a professor at St. Louis University and a public health professor, is very interested in the relationship between humans and their data, the ethical concerns about who owns data and what does it mean to people, and is doing some very interesting survey work on these ethical questions. So the fellows were funded to work with us, to collaborate together, but also to produce work that would inform a broader understanding of ethics and geography. Next slide. So as our world seemed to turn rather dramatically this spring with the advent of COVID, we, in collaboration with the Henry Luce Foundation, decided to begin the Location Tech Task Force, which is ongoing. And what I'm going to present today is some of our preliminary findings. Next slide. So the Henry Luce Foundation, Luce was a journalist, owned Time Inc., and the foundation is concerned about improving public discourse, awareness of science, influencing policy and leadership. And it's worth mentioning that the current president of the Luce Foundation is Dr. Mariko Silver, who has a PhD in geography from UCLA. She's an economic geographer, but she also had a distinguished career in government. She worked for the Department of Homeland Security, looking at international policy, and then was president of Burlington College in Vermont. Did I say Burlington? Bennington, I meant. So she has her feet and experience in academia and government, and then this social sector. So as the foundation was thinking about ways to respond to COVID and it's a massive issue, but what would be a thin slice, an area that maybe people had not focused as much on. The location tech was an area of tremendous concern. Meaning as the various tech companies, Apple and Google, talked about rolling out location tech tracking devices, what would that really mean for privacy? Who would own this data? And it seemed like it was a way for a geographic community to contribute a small slice, but we think an important slice of information, of understanding the response to COVID. And the belief is that these technologies, as they advance, maybe wouldn't end with COVID, but could continue. And this was especially of interest and concern to us as an organization. Next slide. So how do we go about doing this? Well, we of course knew we were going to be doing this virtually. And so we decided to create blue ribbon panels and leadership spotlights. And this both involved a lot of phone work using our networks. Again, we have a council that's diverse in terms of participation from government, business, academia. We reached out to people and there was enormous interest. Especially the human rights community, people concerned with legal aspects of privacy, ethicists, technologists. And as we talked to people, we developed a variety of themes. I'll show you those in a minute. To begin to think about what are the consequences of this technology? Who are the vulnerable publics? How has it been used before? What is its relevance to COVID? And then we also decided to actually do some spotlights where rather than a panel setting, we would interview one individual. The blue ribbon panels are quite involved. They're online. You can register for them or watch them on Facebook Live. The way they work is that the panelists, there could be 3 to 5, do a formal presentation. Then there's questions among the panelists led by the moderator, and then the public can also ask questions. So we see these not so much as entertainment, but a type of testimony of getting the issues out there and making people aware of some of the potential concerns. And interestingly, we found that Facebook Live has been a really important forum. People can find it, and several of our panels hundreds of people have viewed them. So, but we also have them recorded and available on our website. Next slide. So far, we have done 3 panels. The hardest thing about doing a panel is getting people to commit to a 3-hour period to participate. And also, these are people from all over the world. So timing is challenging. And that's with COVID, with a lot of people at home. So I can't imagine how we would have pulled this off in a non-COVID environment. But next week, we have a really fantastic panel on national security perspectives. And you can see other ones: state and local experience, data quality, and building trust, and a research spotlight from the Belfer Center at Harvard Kennedy School of Government. And then we have 3 more panels that we hope to set up all in August. We want to finish the panels and data collecting before the end of August. Next slide. So I'm going to talk about some of the panels and how they were structured and what we learned to date. And again, this is an ongoing project, and we welcome people listening to attend the meetings and participate. The Location Tech Task Force, the Blue Ribbon Panel on Vulnerable Publics, the international group, we had many speakers that live internationally. There were 2 really compelling reports on what's being done in the Gulf states in terms of a pretty advanced surveillance state, especially since many of the Gulf countries have large, in fact, the majority of their populations are immigrants, and their movement has long been tracked. So some of these practices certainly preceded COVID, and sort of and have intensified with COVID. There was some very interesting discussion on LGBTQ rights and how vulnerable publics, as a vulnerable public, where their movements and what would be safe places might no longer be safe. And then concerns about children in particular and their levels of vulnerability. So that was a robust discussion that brought in a diversity of viewpoints. Next slide. And then we had a very, very insightful panel on vulnerable publics in the US. It started off with Dr. Charlton McElwain, who is Vice Provost at NYU. And he made the point, especially among African Americans in the US, that they've seen this narrative before. A crisis is declared, whether it's the war on drugs, the war on crime, the fighting COVID. New technologies have been introduced, and surveillance, and in some cases, repression has been advanced. Similarly, groups that are looking and working with immigrants and Native Americans have some similar concerns, so that the sort of narrative that these technologies could be securely managed and privacy respected was in doubt by many of the panelists. At the same time, they saw possibilities of how it could be used well, but were very skeptical of the control either by government or the private sector. Next slide. I've made these points already, but one of the themes that came up, especially with international, is these regimes where there's digital repressive technology already exists, and examples from China, from facial recognition to tracking of Uyghurs, to many examples in the Gulf states. At the same time, there have been governments and liberal democracies, Norway, for example, that initially just tried the mobile location tracking system and then ceased it because they weren't convinced that privacy would be respected. There were also some interesting examples of Singapore probably using location tech in a very responsible way. In the US context, we still have some more reporting to do. But certainly for ethnic minorities and immigrant groups, there was more concern than enthusiasm for this technology. Next slide. So a week ago, we invited Ambassador Samantha Power for a spotlight. And she was the ambassador to the UN the last 4 years of the Obama administration. And before that, she served on the National Security Council. And one of the interesting things we talked about was she was at the UN during the Ebola outbreak in West Africa from 2014 to 2016, which was suppressed. And I asked her to make comparisons to that experience. It was an epidemic, not a pandemic, but she highlighted the international collaboration and also the support of both UN and WHO, how a number of countries were supplying technology resources. And then when she said she looked at COVID today, there was no clear leadership. The US is not really cooperating with major international organizations. And moreover, on a sort of higher level, she said that the polarization in the US at this moment, the political polarization, the attack on science, the dual sets of facts that seem to operate exclusively from each other, makes a response to COVID extremely difficult. And that's not even taking the technology into consideration. Next slide. So one of the things that we are going to do after gathering this data is we're partnering with Benchmark, which is an organization in the UK, to develop what we call the Locus Charter to try and come up with ethical standards of how such data could be used. And this is just beginning. We're still in the data collection, but the end goal is to come up with some guidelines, and we would welcome people's comments and input as this goes forward. Next slide. So there's some time for questions later. I just wanted to say that the concern with location tech is a small slice of a really big questions that COVID bring in terms of public health and the economic consequences and even the political consequences. But I think in taking this small slice, shrinking the change as it were, there's space for geography and geographical sciences to make a really important contribution. Thank you.
Thank you, Marie. We are going to transition quickly to Elisabeth. Elisabeth, the stage is yours.
Thank you very much. So what I'd like to do is, start my video. There we go. Sorry, the host asked me to. What I would like to do is take some of that wonderful thoughts on ethical and use of geographic data and bias and whatnot, and put this into context into some of the work that I've been doing over the last 3 months with the Ohio Department of Health around contact tracing. I've been working pretty hard for the last 3 months trying to help my state. I'm at the OHIO State University, but trying to help my state figure out ways to use data to better understand what is happening with the epidemiology of COVID across the state. And one of the deep concerns is contact tracing, and how do we try to control something, this disease that doesn't have a vaccine, doesn't have therapeutics yet. How do we try to keep it contained in the absence of any medical technology that helps us do that? And contact tracing is one of the main tools that we have at our disposal for doing that. So next slide. So at its very core, contact tracing is a process by which you identify people who are infected with some disease, in this case, COVID, and then you do some form of tracing or monitoring the contacts that they've had to try to contain or control the spread of disease. And so I really like this graphic. The Seattle Times posted it a couple of weeks ago in their publication. But if you start with individual number 3 there, who is positive for COVID and receives medical care, and we identify them, Contact tracers essentially then ask that person, who were you in contact with? How can I contact that person? Can you provide me information for how to contact that person? And so contact tracers then go through this process of contacting those folks and asking them a series of questions about whether or not they've had symptoms and whatnot, encouraging them to go get tested. And through this process, we do what we call box in the disease. We identify networks through which disease might spread, and we box them in so that we can isolate them so that there's not continued spread. So typically, the way that contact tracing is done is it's a form of social network analysis, right? So you take the person who's been identified with COVID and you ask them about their social networks, and you construct basically a disease network through this investigation process. And so that's the sort of status quo. That's what we've been using for decades now in order to box in diseases that we're trying to control in populations. Next slide, please. So much of what we know about contact tracing actually comes from the HIV epidemic. Contact tracing was not highly utilized prior to the 1980s when HIV became a real issue. And again, this was a disease that had no cure, still has no cure. There weren't therapeutics in the 80s. We now have therapeutics for folks with HIV who are HIV positive. And so there was a necessity to contact trace in order to box in or contain the disease, similar to what we're seeing today with COVID. This disease, however, spreads through sexual networks, of course, through physical contact. And so what we're challenged by today is, what if we have a disease that is not just transmitted through personal contacts, a disease that's spread through the air or through contaminated inanimate objects like doorknobs and desks? And that's what we're facing with COVID today, is that we have a disease that a majority of experts believe is spread through microdroplets in the air or through contaminated inanimate objects. And so contact tracing may need to change. We now really need to know where a person went, not just who within their social network they interacted with. And so this calls for a need to incorporate geographical contacts into the traditional social network type contact tracing that's been done traditionally with other diseases like HIV. Next slide, please. We also know that mobility plays a very key role in the transmission of COVID-19. So on the left here is actually a transmission map that was created that shows from, it's actually from a study that was done in Singapore. It shows how COVID-19 was imported initially from an index case, which was linked back to Wuhan, China. And that's the yellow dots, right? These are Wuhan travelers, and they came to Singapore and they went to a church service. And then they actually transmitted the disease to those folks in that church service. One of those folks then went to another church or a family gathering and transmitted the disease there. And so it was actually transmitted through a series of contexts in specific locations. And so what we see from these types of transmission maps is that the spread of disease happens through co-location in space, not just social networks. So geography plays an inherent and extraordinarily important role in the transmission of COVID-19 that we don't necessarily see with diseases like HIV or even diseases that are harder to transmit, like, things like E. coli, which is where a lot of contact tracing goes into as well. Next slide, please. There is one study that's actually been done, and it was done with the first SARS. So COVID-19 is also called SARS-CoV-2 because it's sort of a second generation of SARS that we're seeing. So a lot of several years ago, when SARS the first was circulating around Southeast Asia, there were a series of studies that were done to look at how it was transmitted, and this is actually one of the ones that came out of that. And what this group of researchers did is they actually studied geographic contexts as well as social contexts to explore how the combination of both actually transmitted to the disease. So they included geographical locations that people with SARS-CoV-1 had as nodes, and then they also included the social network. And so what you see on the right is actually the contact network. And what this did is actually increased the number of contacts that occurred about tenfold. So adding that geographic component increased the contact network exponentially, actually. And this is really important because this type of understanding of both the place-based transmission as well as the social network-based transmission allows us to visualize the role that location plays in disease transmission. It actually allows us to understand bridges between geographic locations, so we understand how the disease jumps from small population to small population within our larger communities. And so it also allows us to understand how it gets into one social network from a totally different social network. So this type of combination and bringing in geography and place is really important to our understanding of the dynamics of disease transmission, especially for something like COVID-19. Next slide, please. So what this tells us is that the way that we've been doing contact tracing is extraordinarily labor intensive for a disease like COVID-19. The CDC and the Harvard Global Public Health Institute has estimated that you need about 1 contact tracer per 1,000 population. So where I live in Columbus, Ohio, we have almost 1 million people now. It means that you need a small army of 1,000 contact tracers to sort of keep up with the load and contact trace and call all of those people to be effective at boxing in the disease. This is a challenge because contact tracing in the way that we do it now is less effective when you have a disease that has a really high asymptomatic rate. COVID-19, we think the asymptomatic rate is somewhere between 30 and 40%, because you wouldn't even call and contact those people and try to box them in. It's really less effective with a disease that has a long pre-symptomatic period. And for COVID, it's somewhere between 7 and 14 days, a pre-symptomatic period. Because again, those people can be out and about and they can be affecting folks and not even know that they have the disease. It's also very, very difficult in high population density areas. So my example of Columbus, Ohio, with almost 1 million people, the amount of contact tracing that needs to go on because the transmission is higher in high density areas is a monumental undertaking. So that means that it's been very difficult to effectively trace geographic or place-based contacts. When a contact tracer calls, they ask about people you've interacted with, but can you imagine them asking you, can you recall all of the places you've been to? And how then do contact tracers figure out who else was at those locations? So if I tell the contact tracer, well, sure, I went to the Giant Eagle grocery store down the road twice last week. Think of all of the other people that I could have infected during my time in that grocery store, and how in the world would a contact tracer even figure out who those folks are? Next slide. So one of the solutions that has been posed to tackle the challenge of contact tracing under COVID-19 is digital contact tracing. And this is a way, it's been proposed as a way to basically automate the collection of contact data using some form of a smartphone app. Next slide. The base idea behind this is that if you have a smartphone with the application loaded onto your smartphone and you give it the correct permissions and everything, phones send out regular Bluetooth pings to nearby devices. And if another phone stays within 6 feet of you for more than 15 minutes, those phones exchange a code. And then if a smartphone owner actually tests positive and you put that into the app and say, yes, I have tested positive, your app would then send an alert to the other devices that you exchanged codes with in the past 7 days or something like that, and alert that person that they may have been exposed to somebody who was COVID positive. If allowed, health providers or local public health agencies could have access to that data too, so that they could roll that into the contact tracing that is currently going on in a more traditional manner. As you can see, this might be a much more effective way of tracing geographic contacts than trying to call people and ask where they'd been and then figure out who else had been in those locations. Next slide, please. So this is actually from an article that was published in Science about a month ago by Ferretti and his colleagues. And this shows you how this works, right? So day one, person A is at home and they're with person B, their smartphone app is on. And then they get on the train and they sit next to person C and D for more than 15 minutes. And then they go to work And at work, they have a bunch of colleagues, E, F, and G, that are close by to them, maybe in the cubicles right surrounding them. And then you have H and I, who are actually nearby, but maybe not within 6 feet. And then that person goes home again. The next day, that person wakes up with a fever and they report their symptoms and they request a test, or maybe they go get tested and they find that they're positive. And then what happens is an instant signal is sent from their phone through the app to the other individuals, B, C, D, E, F, and G, who they were in close proximity to for a long period of time, and tells those folks that, hey, you might be able to, you might want to go get tested, or you need to self-isolate, or you need to monitor yourself. And in this article, they showed actually that the growth rate of the disease would actually decline if something like this was enacted. They did a geosimulation. It was a really interesting article. I encourage folks to read it. Next slide. So it has actually been brought up, of course, that there are deep privacy concerns for digital contact tracing. And it is based on 2 different technologies that have been suggested. I gave you the Bluetooth example, but there's also a GPS example. So there are some apps out there that collect location data and it alerts users that have been in geographic proximity. So it actually stores and uses geographic proximity information to then send out that alert to other people that you might have exposed if you were to become positive. This methodology, it's quite difficult to maintain the privacy of users. Geographic location is stored and used actively as part of those applications. And of course, many of us understand that you can algorithmically determine place of residence if you have that kind of information available. It's relatively easy to identify a person. And so the GPS apps have brought up a tremendous number of privacy concerns because of the way that they store and maintain and use data, and in particular, geographic data. The Bluetooth option was suggested as a methodology where there's better safeguarding of privacy. And that's because the phone app stores a code based on your sort of everyday interactions and no locations at all. And so the user also can therefore control the personal information that's put into the app. And it has been proposed as a method to do something similar, but not perhaps retain the privacy within this system. Next slide. So one of the reasons we need to consider how these apps are developed and how to maintain privacy is that polls by and large show that there's not a tremendous wave of support for digital contact tracing. There was a survey done by the Brookings Institute about a month ago that asked people, what's the likelihood that you would download and use a hypothetical contact tracing app? And you can see that a good 40%, depending on what racial group you look at, said that they would be extremely unlikely to use something like this. And then an additional, basically 25% said that they would be somewhat likely or ambivalent about it. And really only about 20% of the population was very supportive of such an application. Researchers at Royal Institute in Oxford and Harvard have suggested that you need at least 60% of the population to use the app in order for it to be effective in decreasing COVID transmission. Next slide. And in addition, there was another survey that was done where they asked why basically you wouldn't use the app. And the biggest concern actually over the COVID contact tracing apps was about digital privacy or trust of how their data would be used by the application providers. Next slide. So there are lots of challenges inherent in using digital data to help us with contact tracing for COVID-19. And I put them into sort of implementation and ethics and bias. So the implementation side is that, to get something like this up and going, there needs to be fairly large social mobilization and mass marketing media campaigns for public adoption of these things. And we haven't seen that. And that's largely because we haven't seen a sustained federal response in support of these. And some states have tried, and other states like my own have not been interested at all in a digital contact tracing app. And there needs to be a way of building and sustaining public trust on the intentions of how these data are being used and how privacy is going to be preserved. because that's clearly an issue. The other big thing is that I don't know how many of you have looked at digital contact tracing apps, but there's, I would say, 20 different ones that have been fully developed and are being marketed to different organizations out there right now. And you can't have 20 different applications. You need to have a cohesive and coherent response because you need to get to that 60% of the population. And again, in the absence of a strong federal response and a strong federal leadership on this, we've seen this burgeoning of apps from all sorts of different companies that want to move this technology forward. And then the other challenge, of course, is how do you prevent hacking and other unauthorized access and use of this data? Because this is protected health information and is probably one of the most private pieces of information you maintain on yourself. Next slide. And the other challenge that I see is ethics and bias. There are a tremendous amount of ethical and legal questions related to electronic contract tracking. And not just with COVID-19, but in general, right? How are our apps tracking us as we move through space? And what does that mean? And I think when we add in this added level of this is a health related outcome, this is a health crisis, these ethical and legal questions become even more important and more difficult and challenging for the implementation of these technologies. There's also deep socioeconomic and technology biases that occur in our populations. Smartphones are not generally, not everybody has a smartphone, right? And in fact, the lower socioeconomic groups and the individuals with technology literacy issues like our elderly tend to be the ones that don't have and use these. And these are our most vulnerable populations for COVID-19. So this is a real challenge. There's also rural and urban inequalities. In my state, in Ohio, we have the rural Appalachia South, and the ability to use cell phones in many of these areas is non-existent or very, very challenging. Final slide, please. So, I come back to this digital contact tracing being a vast improvement over the way that we're doing contact tracing now in terms of for COVID-19, given the way the disease spreads. But I always have to ask, will it work? And so far, what we've seen is there's been widespread problems with adoption, effectiveness, and data privacy. We've seen in our own country, Utah made an effort to do it, and they essentially had to pull it out. Texas made an effort to have a digital contact tracing app, and there were all sorts of holdups, delays in rolling it out, and the technology, but also privacy concerns and consumer groups suing over privacy. Norway suspended their use. The UK opened one. They had a fiasco. They had to shut it down again, and they had to restart. So by and large, this has not been a success at this point in time. Next slide. So just to sum up, for airborne diseases like COVID-19, incorporating geographic location into contact tracing is really important for curbing the spread of the disease. And digital contact tracing and using apps that try to incorporate place and space and geography hold a tremendous amount of promise, but they've encountered such wide range of barriers to adoption. So I do believe that traditional contact tracing needs to include a thorough review of mobility and geographic location. And I think that there's technologies out there that can help us, but that we have not effectively been able to harness and use that for the current pandemic crisis that we're in. Thank you very much. I'll end there.
Thank you, Elisabeth. Thank you, Mary. We are going to get into the Q&A session. There are a few questions posted, and my request to the rest of the listeners or participants is keep the QA box flowing, and I'll try to quickly. We have about 7 minutes for QA, so let me pick the first question, and I'm not really sure who that is intended for, but I'm going to guess Mary. What program are you able to use to blend geography or place and network analysis? Or maybe it's for both. I'm guessing it's for Mary.
You're muted.
again, we're not looking, I don't have an answer for that question, but I bet Elisabeth does.
Yeah, I kind of do. So the conversation of how do we blend geography and social networks into understanding networks as a whole. Some of the work that we've been doing is essentially is using the social network analysis tools. So it would be the software where you basically are creating matrices of how you kind of think about it as a matrix of every person and every person. And if they have a social contact, right, you can designate that. And you can use a similar technology with geography, right? So you have every person and every person that's in this app, and you can say, okay, well, who has actually been in geographic proximity? And you can create a network that way. And so what we've really been doing is actually harnessing the social network analysis tools and transforming our geography into a network, right? Network geographies, and then running very similar analysis on that. And so that's the way we've coped with it. I have to say, it's kind of an area in its infancy in geography, sort of this geosocial spatial network, if you want to come up with a name for it. And so far, we've been borrowing from our sociology friends on how to work with that.
Thank you. Let me see. One quick question was, are there known results of these apps in Australia and Asia?
So yes, we have definitely seen great success in South Korea. I think they're the big success story. They were very effective at getting an app up and running in South Korea. Very widespread adoption. I've heard something like 70 or 80% of the population has an app on their phone. It's all the same app. And as you see, South Korea managed to basically quash this disease in a pretty short period of time. So there haven't been any, I would say, empirically rigorous studies that sort of test the effectiveness of this technology versus something else. But we have correlative evidence, perhaps I should say, that in countries where this has been widespread and adopted and well used and done correctly, we've seen a dramatic decline in effectiveness of the contact tracing and reducing disease.
Great. There's one question that maybe you can provide perspective, both of you, which is the obvious question of, the ethics for the authority who collects these kinds of data sets. So, somebody in the, position of power, if it's dominated by government officials, how can we ensure that it's not misused or abused?
Well, that seems to be the huge question, right? Because a lot of the apps are developed by the private sector, and they have access to the data. And then even the interface between government and private sector hasn't been smooth. Actually, on one level, I think the public is right that there's not a real privacy is not secure. And I think that's where the reluctance is. And in the US context, I think we're just in such a polarized state that it makes it, the trust is so low that maybe it's not the same in South Korea.
That question reminds me that there is also another issue is that, is this something that you could potentially see down the road as being privatized? We know that the auto insurance company collects data, and the incentive is you get a discount in your policy premium if you are, going by the laws and the rules and not speeding. Do any of you want to comment on the role of private sector in here? Do you see that the health insurance companies requiring you or expecting you or incentivizing your participation in contact tracing for a hefty or a sizable discount in your premium?
Well, we've seen a model of that in the past. There are actually quite a few health insurance companies or companies like OSU, where I'm at, that provide an incentive if you wear a fitness tracker, right? And you monitor how much exercise you're getting. I actually don't know how effective those have been, and whether or not I know a lot of people who do it, and you get a reduction in your premium, or you get money in your health savings account or whatnot. This is a public health crisis that needs to extend beyond private insurers. They're a patchwork, they're a network, they're not a safety net. And so in my opinion, this is something that needs to be rolled out and whatever by our state and our federal public health agencies. Like, that's totally my opinion, but this is a true public health crisis like we've never seen.
There's one related question that I think is interesting is, how do you do this in an environment like Africa where you may not have enough Bluetooth penetration?
Well, we know the data for South Africa is not good, and maybe it's worse in other places just because there's not the testing. But it is instructive to look at Ebola, in that it was a highly contagious disease. But it happened in a remote area that wasn't as well connected to the world as Wuhan obviously was. And yet there was, from, a range of technology, low tech, from, people described having pins on the board of a map, little red pins and green pins, and marking where infected areas to respond. But it took an enormous effort from the international community and cooperation. And right now, since it is a pandemic, it's everywhere, I think there's a great concern that cooperation won't and the resources won't be there.
Okay, unfortunately, this is such an interesting and topic, and both of you have spent an enormous amount of time telling us about your perspective, and there are 21 questions, and I wish we had enough time to go through this. We may be able to capture these questions and send it to the two of you, and there are some questions that are specifically targeted for one of the two, and maybe you will take time to respond to them, and I will encourage the participants to contact Mary and Elisabeth directly. They're easily findable on the web and their university's sites, and have them this question. So thank you again, Mary and Elisabeth, for taking the time, and thank you everyone for tuning in today and participating in these discussions. And I would also like to thank the organizers, the Geographical Sciences Committee, and the National Academy staff for making this thing happen. So thank you again, and we will sign off.
Thank you.
Thank you, everybody.